Let's have a look at the rare collisions. What are the rare collisions? Well, this is not very, very rare. We can see some of these cases in the practice. We see a lesion which is clinically composed by a brown, a little bit atrophic part and a more dark spot on top of the lesion. So here what we have a dermatofibroma colliding with, again, a nevus, which is also nice. Okay, and here this is very rare. I have only one or two cases looking like this. This is a combination of a pink papule, a little bit scaly, and a brown macule on top. And here we see the brown macule on top is looking like a solar lentigo because of the moth-eaten border. And at the bottom side of the lesion, we see these glomerular vessels with scales. Therefore, this is what Bowen's look like, and therefore this is a combination between Bowen's disease and solar lentigo. Quite nice. But this is really the best combination that we can see in our practice. Until now, we saw a combination of benign with benign, basal cell carcinoma, so malignant with benign. But here we have the combination of two malignant lesions. On the right side, we see a basal cell carcinoma, and on the left side, what we can see is a lentigo maligna, a melanoma in situ. So this is something that could happen, especially on the face of elderly and sun-damaged patients with sun-damaged skin, and therefore these kind of combinations can be sometimes visible in these particular patients. And finally, is this final combination a collision? Well, this is what we can stereotypically see in a so-called combined nevus. So we have a small congenital nevus, the brown area, and a spot of a blue coloration which is corresponding to a blue nevus. Okay, so here we have a combination of a congenital nevus plus a blue nevus. Is this a collision? Well, not really. This is more obviously a congenital nevus with two cell populations, a more superficial population of cells and more deep one with blue component. Okay, and here what we have another combination, two kind of nevi. One on the right side we see reticular nevus. On the left side, if you just look at the heavily pigmented area, you see this kind of beautiful streaks at the periphery. So this is a Spitz nevus colliding with a reticular nevus. Is this a combined nevus or a collision? I'm not sure. I would say not easy to establish a kind of a causal phenomenon here. And again here a combination of two nevi. On the right side a congenital nevus, and on the left side a non-pigmented Spitz nevus with this beautiful reticular depigmentation. So finally we saw many cases of colliding tumors, SEP case plus something, BCCs plus something, plus nevi, plus seborrheic keratosis and so on, nevi colliding with many other types of usually benign lesions. And finally I want to show you the king and the queen of collisions, what this could be. Look at this patient. This is a 75-year-old lady, and here you see a combination of two very different lesions. On the left side, bottom side, we see a classical dermal nevus, but on top and right side we see what? Again, melanoma in situ. So you can say, okay, come on, this is not a collision. This is a melanoma, a nevus-associated melanoma. Well, okay, but how can it be possible that a melanoma is developing on such a banal and intradermal nevus? So it could be something causal, so there could be some etiopathogenetic steps behind, or it's just again a by chance phenomenon. I cannot tell you. I really don't know how to answer this very long-standing question, and with this long-standing question I thank you for your attention.